Hello, my name is Christina, and I chose discharge education in post-surgical patients for my evidence-based practice project. So this project was chosen because patients were being readmitted due to surgical site infections and other post-operative problems. And after talking to a few of my fellow nurses, it was found that discharge education was only being done the day of discharge, rather than starting it early. And the patients, being readmitted, stated that they felt they didn't quite understand the education they were given prior to leaving the hospital, and that they felt kind of rushed out. And unplanned readmissions are costly for hospitals. $528 million was spent in fiscal year 2017 nationwide on unplanned readmissions. So it's a pretty big chunk of cash right there. So my PICO question, the population is post-surgical patients, the intervention is individualized and early education for discharge, comparison is standard day of discharge education, and the outcome is the unplanned readmission rates. So the overall question is, in post-surgical patients, how does individualized and early discharge education affect unplanned readmission rates compared to the standard day of discharge education? The literature search was completed using databases like CINAHL, Medline, EBSCO, and PubMed. Search criteria included discharge education, surgical patients, readmission, surgery, discharge, and education. The articles were chosen based on the date published, whether or not they were primary research, and the relevance to the author's unit, cardiothoracic and vascular step-down. This process was a bit complicated and frustrating, particularly because most of the research articles found were secondary research articles, meta-analysis, etc. So a lot of the digging and searching done was in the reference lists of these meta-analysis articles. The literature synthesis, the overall themes that were discovered were discharge education reduces post-discharge problems, discharge education increases patient self-efficacy and confidence. Discharge education should be individualized, should be started early, and that it should be taught via the teach-back method. The practice recommendation is that discharge education should be started early, should be individualized for the patient, and should be taught via the teach-back method. Something super simple, such as starting incision care education the day the post-op dressings are removed. A lot of times nurses will go in, strip down the dressings, clean the incisions, and just leave it at that. And this patient's incision care, the education, and the bags that we give them are not given until a day or two prior to them leaving the hospital. I personally do this with all of my patients. The day of removal of the post-op dressing, I go in, I talk to them, I say, all right, this is what we're doing, this is how you'll take care of this at home, and then I have them show me via the teach-back method either the following day or later that afternoon. Some potential issues for this recommendation is that a lot of nurses are resistant to change. They don't like switching up how they do things. They might say, hey, I don't have time to go in and do this day of, post-op removal, this, that, and the other. But patients that can also be unreceptive or unable to participate in education. Those patients, we have all had them. Some are very resistant to any kind of education, or are patients who are unable to participate, are dementia patients. But that is where bringing in caretakers or family, because our students per se are not just the patient but their support system as well. So in conclusion, patients are frequently readmitted to the hospital for poor understanding of their discharge education, costing hospitals upwards of $528 million nationwide. Research has shown that patients who understand their discharge education are less likely to suffer from post-op issues and are more confident caring for themselves at home, and are therefore less likely to be readmitted. And discharge education via the teach-back method should be started early and individualized for the patients. Starting simply with incision care would be a great start. And here are my references. Feel free to look them over. If you guys have any questions, please let me know. I hope you learned something from this, and maybe you'll start doing some discharge education a little earlier. Thank you guys so much.